Hello, everyone. Thanks so much for joining us for today's presentation. Need help paying for your meds? HealthWell may be able to help. I'm Carla, the Director of Education Initiatives at Needy Meds. And before we get started, I'm going to offer a few tips so you can make the most of the presentation. First of all, if you do have questions, we encourage you to ask them at any time by typing them into the questions Q&A chat section of that of that Zoom control panel. Just know we will reserve answering questions until the end. If we don't get a chance to answer your specific question, we will follow up with you by email as quickly as we can. However, since that may take a little bit of time, don't hesitate to reach out to either Needy Meds or the HealthWell Foundation directly if you need assistance more quickly. And of course, I will provide that contact information at the end of the presentation. I'll also take a moment to share that today's webinar, like all of our webinars, is being recorded and will be uploaded onto the Needy Meds YouTube channel. I think it's a great idea to subscribe. That you'll be notified when it is uploaded. A few other bits of information about the follow-up you can expect from us. You will receive a follow-up email directly following today's presentation that will provide some information about the HealthWell Foundation, again, our contact information, which we hope proves helpful. You will also, however, should expect an email from me, which will include the video of today's presentation. That take us a little bit of time because a colleague of mine does have to convert the video into a webinar. But in that follow-up email, I will include a video of the webinar. I will also include, we have a HealthWell Foundation video that we'll be sharing as well. I'll have a couple of important handouts from the HealthWell Foundation. And I will also include a link so you can check out and register for other upcoming Needy Meds webinars, which will include future webinars from our partner who's presenting today, the HealthWell Foundation. So let's dive into why everybody's here in just a moment. But before we get to that, I want to remind everybody what Needy Meds is and what we do in case you're not already familiar with us. So we are a national nonprofit, and what you're looking at on our screen is our fancy mission statement. But simply put, Needy Meds connects people to essential healthcare savings resources, and we do that completely free and completely anonymously through both our toll-free helpline, 1-800-503-6897, and our website, needymeds.org. So when time allows, please peruse needymeds.org, check it out, see what it has to offer, and also check out those upcoming webinars where we do populate that webinar calendar events with presentations about Needy Meds and the resources we have to offer. So check that out when you get a chance. And you can find those upcoming webinars on needymeds.org on our homepage, bottom right-hand side, calendar of events, as well as under the education tab. So, I got a little ahead of myself there because just like everybody that's here today, I'm eager to get to our presentation. But before I do, I just want to point out that as you saw, a big part of our mission is educating people. And we fulfill that part of our mission in a couple of ways. By educating people about Needy Meds and the healthcare savings resources we offer, but we also fulfill that education part of our mission by educating our users about other reputable, reliable nonprofit organizations and resources they can use to help them with their healthcare journey, which is why we are so pleased to have my friend and colleague, Audrey Cordy from the HealthWell Foundation here with us today. So before I hand the mic and the screen over, I just want to say a few quick words about the HealthWell Foundation for those of you not yet familiar with it. The HealthWell Foundation is a leading nonprofit dedicating to improving access to care for America's underinsured. Their mission is to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. When health insurance is not enough, HealthWell fills the gap by assisting with copays, premiums, deductibles, and out-of-pocket expenses. And as you can see, they have a great website. Not only is it really modern and fresh looking, but importantly, it is really easy to navigate. So I encourage you to not only check it out after today's presentation, but share it with your friends, loved ones, patients, and clients. And of course, you can also follow them on social media. So let's now transition to my introduction about my friend Audrey, who's going to chat with you all about the HealthWell Foundation and how it can help you again in your healthcare journey. So Audrey is the Associate Director of External Relations at the HealthWell Foundation. She has more than 12 years of experience in the healthcare industry, focusing on health insurance coverage, reimbursement, and patient assistance programs. In her current role at the HealthWell Foundation, Audrey acts as a liaison between healthcare providers, pharmacies, and HealthWell. Her main responsibilities include ensuring that providers and pharmacies understand HealthWell's programs and processes, listening to feedback, and advising senior management team on the most effective ways to increase stakeholder engagement on behalf of the patients. Now, you're going to see once you check out that website and throughout Audrey's presentation, how focused the HealthWell Foundation and their team are making the experience seamless for their patients, for the patients that turn to them. Anyway, in addition to these responsibilities, Audrey coordinates activities with the external relations and operations team to maintain and increase stakeholder satisfaction. Audrey obtained her Bachelor of Science in Marketing from Syracuse University and certified as a nuclear medicine technologist. So you can see with that impressive introduction why she really is an expert, and we're so happy to have her here with us today. So I'm going to go ahead and stop sharing my screen. Just bear with me. I jumped ahead once again. I'm going to go ahead, if my computer will cooperate, and stop sharing my screen so that I can pass the mic and the screen over to my colleague, Audrey, so we can get into today's presentation and again, why everybody's here. So let's see if Audrey can go ahead and grab the screen. So again, bear with me while we make that happen, and feel free, Audrey, or if you have a team assisting you, to do a show. Oh, beautiful. There it is. I was going to say to just verbally let me know if there was a problem. So I can see your screen clearly, and your slide deck is in PowerPoint mode, slideshow mode. So it's large on the screen, and I'm getting feedback from our audience that they can see your screen as well. So thank you everybody for joining us. And without further ado, I'm going to go ahead and pass the mic and the screen to Audrey. And as I had said, if you do have questions, don't hesitate to submit them throughout the presentation, and we'll do our best to get to them at the end. Thanks so much, everybody.
Thank you so much for your kind words, Carla. Hi, everyone, and thank you again for joining us today to learn more about the HealthWell Foundation and how we may be able to help you find help in paying for your out-of-pocket cost for your medications. My name is Audrey Corte, and I'm the Associate Director of External Relations at the HealthWell Foundation. As Carla said, this webinar will be recorded and shared with participants. If you have questions during the webinar, please share them in the chat box. I will try my best to answer them at the end, but if I don't have time for it, we will respond, or I will respond via email. Also, my contact information will be shared again at the end of the presentation. So before we get started, let me share the roadmap. So today, we will learn more about the HealthWell Foundation and its programs and processes, as well as learn how to apply for assistance in minutes and file a claim to receive payment. I will also share some helpful tips for navigating our portals and tools to maximize your search for patient assistance at HealthWell. Okay, let's go ahead and get started. The HealthWell Foundation is an independent 501c3 national nonprofit organization established in Germantown, Maryland in 2003 to improve patient access to life-changing medical treatments. Since its founding, HealthWell has awarded over 1.5 million grants and paid over $4 billion to more than 930,000 patients. Also, it is important to note that 100% of every donor dollar we receive goes directly to the patient's grants and services, and that is something we are very proud of. We have also received accolades from leading charity watchdog groups and publications about our efficiency and transparency. So when health insurance is not enough, HealthWell fills the gap by assisting patients with out-of-pocket costs such as copays, coinsurance, and deductibles for prescribed treatments. We also assist with health insurance premiums for the primary or secondary insurance of the patient, as well as other costs related to travel, pediatric treatment, vitamins and supplements, and behavioral health services. Some disease funds are Medicare access only, meaning the patient must have Medicare insurance to qualify, while other funds require that the patient have any form of insurance. And we'll go through that a little bit later. At HealthWell, we have a wide range of disease fund categories, from autoimmune diseases to urologic disorders. We assist with over 90 disease areas, including 30 in oncology alone. And as part of the White House Cancer Moonshot Initiative to end cancer as we know it, in 2024, HealthWell has committed to providing more than $300 million to underinsured oncology patients to offset out-of-pocket costs for their medications. In addition to the Cancer Moonshot Initiative, last year, we launched and reopened 24 disease funds, and we continue to grow. So under each of our funds, HealthWell pays the out-of-pocket costs for all FDA-approved medications or compendia listed for the disease state. This consists of prescription medications listed in the covered treatments that includes generics, brand, and biosimilar medicines used to treat the disease area, or the insurance premiums for private and government health insurance. And we also have other specialty funds, which we will review on the next slide. So HealthWell has a diversified portfolio of specialty funds to assist patients in underserved areas such as behavioral health. The Behavioral Health Fund for cancer patients and emergency medical workers assists healthcare professionals and emergency workers such as paramedics with the out-of-pocket costs for mental health. And this includes prescriptions, counseling services, psychotherapy, and transportation. We also have the Pediatric Assistance Fund, which was created to support a wide range of disease areas affecting children. Since its launch, we have helped children in over 400 unique diagnosis areas. And this is a fund that is funded by HealthWell, so this is something we're also very proud of. The fund helps with the cost share for prescription drugs, biological therapies, devices, and other treatment cost shares related to various disease areas or conditions. Please note that this fund accepts phone applications only, but it is currently closed, but it will reopen in the near future. Next, we have the Cystic Fibrosis and Alagille Syndrome Vitamins and Supplements Fund, which was created out of the specific nutritional needs of patients in that disease area. The fund assists with the cost of vitamins and supplements formulated to support treatment and management. And in addition, we have the Gout Travel Fund to help with the travel costs related to obtaining treatment for gout. This helps with the financial barriers of getting to and from appointments. We all know that that could be a barrier sometimes. And then partnering with Ride Health has helped our patients access assistance without coming out of pocket. If the patient prefers, however, they can pay upfront and get reimbursed. So there are also certain funds or services that fall outside the scope of our coverage. And it is important to clarify that our funds do not cover services such as office visits, hospital bills, and radiation. With the exception of our Pediatric Assistance Fund, we also do not cover medication or services that are not on our list of covered treatments for the disease fund, as well as medications or services paid in full by your health insurance plan and medication or services already reimbursed by another patient assistance program or hospital charity programs. So now that we have learned about our assistance programs, let's go ahead and apply for assistance at HealthWell. So before applying, we do recommend that you gather the following information. First, the patient's demographic information, such as their legal name, date of birth, address, etc. If the patient is under 18 years of age, we require the parent or guardian's information. We also need the insurance and healthcare provider information, as well as the Social Security number. But if you don't have a Social Security number, we will accept a tax ID. Then finally, please make sure that the disease area and the medication you're taking for the treatment, that you know both of those. So let's go ahead to step 1. So after you have gathered all the required documents, the first step is to take a moment to review our eligibility guidelines. Please make sure that you have the following: some form of health insurance coverage for the product through either medical or prescription drug insurance. Certain funds are Medicare access only, which requires Medicare insurance to apply. Please ensure that your household income meets our guidelines, which is up to 500% of the federal poverty level, depending on the disease fund. And HealthWell requires patients to be receiving treatment for the disease fund they apply for. For example, if you're applying for the Porphyrias disease fund, the patient must be treated for Porphyrias, and the medication or product must be on the list of covered treatments. Then finally, you must be a permanent resident and receive treatment in the United States or US territory. Now that we've gone over the general eligibility guidelines, let's review where you can find the specific requirements and other important information on the fund page. So we'll start by taking a look at the Alagille Syndrome Vitamins and Supplements Fund. So first, you want to verify that the fund is currently open and accepting enrollment or re-enrollment application. This is very important, otherwise you can't move forward with the application. Next, let's review the grant amount. In this case, it is $1,500. And then the FPL level, which is under the household income level and for limits. And for this particular fund, it is 500%. Then you want to verify if the fund covers the type of assistance you need. This is also very important because if you're looking to apply for premium assistance, you want to make sure that the fund also covers that. So for this fund, it looks like it's only for copay. So this is an important part that you need to also look at before you apply. And then you want to review the list of covered treatments to ensure that your medication is on the list of approved products. You can also find all specific eligibility criteria as discussed earlier on this page and apply for assistance if you meet all the requirements. So step 2, after you've gathered all the necessary documents and determined eligibility, it is time to apply for assistance. And there are 3 ways that you can do this at HealthWell. The first way is that you can apply through our website at www.healthwellfoundation.org. Second, you can apply through our portals. We have the provider and pharmacy portal for healthcare providers and pharmacy staff. But we also have the patient portal for the patient, caregiver, or guardian. And we created this portal to empower our patients and allow them to manage their grants. Then finally, you can also call us at 800-675-8416. And that's Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Now, if you forgot everything that we've provided in the previous slide, we have made it very easy for you to be able to access this information right on our main page of our website. So first, you can apply by going to the disease fund page. Or second, you can also apply through our portals. And then third, you can click on the apply or re-enroll button on the home page to start your application. And then finally, you can call us. So what we're going to do is that we're going to go ahead and start the application through the disease fund page on our website. So we'll start by navigating to the specific fund page we want to apply to. Please ensure that you select an open fund. For this example, we will select the hypoxaluria fund, which is currently open, and scroll to the bottom where it says, "Do you qualify?" and click on Enroll. After clicking Enroll from the fund page, you will land on the welcome page of the application. We offer the ability to complete your entire application either in English or Spanish. Please select who is applying, the patient or someone other than the patient. Then take a few moments to review our patient attestation and check the box if you agree before clicking Next. Please note that we have designed our portals to be user-friendly and accessible to our providers and pharmacies, and we encourage them to utilize our portals for enrolling patients, which will help them to manage the grants better than using the online application. So we reserve the online application only for the patients, caregivers, or their guardian or family members. If you are a provider or pharmacy and you're on the call today and would like a demonstration of our portals, please feel free to reach out to me at the end of the presentation. So as a payer of last resort, we want our patients to contact their manufacturer first to check if they are eligible for copay assistance through their programs. So here, please let us know if you have already reached out to the manufacturer or are on Medicare and don't qualify for the assistance. Next, we will select the fund by typing in the name of the disease area. For the purpose of this demonstration, choose the hypoxaluria fund and the medication you're taking for your treatment. Then go ahead and answer a few questions to determine your eligibility, including your ability to verify the diagnosis if required and insurance coverage, and then click Next. Here, we're going to choose the type of assistance that we need, either copay or premium, and then hit Continue. And for us, we're going to go ahead and do copay. So we added an extra layer of security to our online application through a two-factor authentication to ensure the safety of your information. So you will need to enter a mobile number and click Send Code. Once you do that, a verification code will be sent to your mobile number via text. Please enter the code in the designated field and then click on Verify Code to proceed to the next step. Then please complete the form with the patient's demographic information, including Social Security, date of birth, and address. And then check the box if you agree to receive electronic communications. Otherwise, this is not a requirement. Next, we want you to add the patient's insurance information, including the policy number and the primary subscriber. So I promise we're almost done. Please complete the prescribing physician information and click Continue when you finish. Then take a moment to review your application. You may edit the information you provided if necessary. If all the information is correct, click the Submit button. Once you submit the online application, we will let you know instantly if your application is approved and follow up with an approval letter. So congratulations, you just completed an online application. Once approved, we offer the following: instant notification of approval and access to start using your pharmacy card immediately. We also provide direct billing with providers, pharmacies, and patients. The approval is for 1 year with eligibility to reapply after 12 months. You may start reapplying 30 days before your enrollment end date. So in addition to instant access, there are other things about the grant that you should know. We offer a 30-day look-back period for each grant to allow the submission of claims with the data service within the last 30 days. We also allow up to 120 days to submit claims after the grant end date. Certain funds offer additional funding or grant replenishments if funds run out during the 12-month eligibility period. Examples of replenishable funds include ALS, Dupuytren's disease, and gout. So for the pharmacy staff on this call, you may log into the portal to obtain the pharmacy card information or visit our website to use the pharmacy card lookup tool. You will need the patient's HealthWell ID. Providers and pharmacies may also locate a copy of the approval letter and claims processing information in the portal or upon request. We also provide the billing information on the approval letter mailed to the patient once approved. Please note that for electronic claims, you will need the pharmacy card ID, the RX bin, PCN, and RX group number, all of which can be found on the approval letter or in your portal. For paper claims, we prefer the healthcare provider or pharmacy to bill HealthWell directly. You may gather the following information to submit a paper claim to HealthWell. You will need a combination of the following to submit a paper claim: reimbursement request form, CMS 1500, UB04, or universal claim form, and an explanation of benefits, pharmacy receipt, transaction screenshot, or pharmacy invoice for us to reimburse the provider or pharmacy directly. As a last resort, patients may pay out of pocket and submit a paper claim with a reimbursement request form and an explanation of benefits, pharmacy receipt or invoice, and proof of payment for reimbursement. All the required information, as I mentioned earlier, is on the portal, is either in your portal or in your approval letter. So once you've gathered all the required documents, simply submit your paper claims in one of the following ways. You may do so through the patient, provider, or pharmacy portal. There, you can upload your claim form in the patient's grant. Next, you may fax your claim to 800-282-7692 or mail them to HealthWell Foundation with the address shown. So now that we have reviewed the online application process and learned how to submit claims, let's review tools and tips to help you manage your grants at HealthWell. So we offer enhanced portals that features navigational tools to make it easy to manage multiple patient accounts. We encourage our patients, providers, and pharmacies to sign up for a portal account today, because signing up for a portal account will allow you to apply and re-enroll for a HealthWell grant. In addition, you can also submit electronic reimbursement requests through our portals. You may access pharmacy card information. You can check the status of grants and payments. And then you can also send an email via Message Center and subscribe to real-time fund alerts, which we'll talk about a little bit more on our next slide. The real-time fund alerts provide instant notification to allow users to track the status of HealthWell's diverse portfolio of disease funds in real time. So simply select the fund or funds you would like to monitor to receive instant email, text, call, or voicemail notification when the fund status changes. Aside from the real-time fund alerts and our portals, we also have other tools to help you navigate your grants. You may use our pharmacy lookup tool on our website to access your pharmacy card information without having to log into our portals. And then you can also check the status of your pre-approval applications on our website. I want to say a big thank you to Carla for giving me the opportunity to be able to introduce HealthWell to you all today. And I hope that you learned more about the foundation. And for more information about charitable patient assistance programs such as HealthWell Foundation, please scan the code on the slide. Now I will turn it back over to Carla, who will lead our question and answer section. You may contact me at audrey.corte@healthwellfoundation.org or by phone at 240-205-4260. Thank you. Over to
Audrey,
you, Carla.
thank you so much for what was, not surprisingly, a fantastic and very thorough explanation of not only what the HealthWell Foundation is and what you guys can provide, but also how easy it is to apply for and manage a grant. So before I just get to those Q&As, and I do see the queues coming in quite a bit, I just want to make sure that, Audrey, you can see my screen. You're looking at a picture of yourself in a slideshow mode, nice and clear.
Yes, I can see that.
Yay, I'm quite thrilled with myself. So thank you for and again, get feedback. I appreciate it from our audience members letting me know they can see my screen clearly. So again, Audrey, thank you. And as I was speaking, we did get a bunch of really great questions from our audience, which will give you an opportunity to maybe drive home some points you made and also the opportunity to share some more information about the HealthWell Foundation. And looks like everybody remembered how to submit questions, but for those of you that are unsure, you could do that by typing those questions into your Zoom control panel Q&A. As we have said, we will do our best to get to as many questions as possible. We do tend to keep the question segment relatively brief, so no worries if we don't get the chance to answer yours. We will follow up with you by email as soon as we can. As I said, if you do have questions that you need answers to more quickly, we will provide the contact information for both HealthWell and Needy Meds at the end. And again, we will share Audrey's contact information that she just shared with you a moment ago. Don't worry, we'll have that up on our screen, my screen, a little bit later on. In the meantime, I just want to remind everyone that Needy Meds is also here as a source of support if you are having difficulty affording your healthcare expenses. That includes, but is not limited to, medications. What you're looking at on the screen are all of the categories of the healthcare savings you can find on needymeds.org under that healthcare savings tab. We also encourage you to peruse our website when time allows, reach out to one of our expert call center counselors, and also join us for upcoming webinars about Needy Meds and the resources we have. And again, you can find those webinars on our homepage calendar of events, which is on the bottom right-hand side, and under the education tab, which is, I believe, right next to that healthcare savings tab on needymeds.org. I'm happy to let you know that HealthWell will be returning later this year for other webinars, and we will convert today's webinar into a video and post it up to our YouTube channel. So let's go ahead and get to those questions that came in. As many of them as we can get to. So Audrey, one of the questions that came in right away is, and this is a really important one, can HealthWell help me pay for hospital bills? Isn't that a good question?
That's an excellent question. We often get that question a lot, if we can help pay for hospital bills. And I would say this, going back into the list of what we cover and what we don't cover, hospital bills are one of those things that we're not able to assist with right now. But we know that there are other programs out there that patients can utilize to be able to help them pay hospital bills. And I think so. One of them is the hospital charity care program. So it's probably, we would recommend for patients to be able to ask their hospital about their financial assistance policy and see if they offer discounts or bill forgiveness based on the income and which is called charity care. So hopefully that they'll be able to get assistance through there. And we also...
Oh, go ahead. I almost cut you off. Go ahead, please, Audrey.
No, and also I want to add one other thing that also on our website, we do have the uninsured resources page, which also provide lots of information about uninsured assistance. But in it are also some organizations that can maybe assist you with hospital bills. So I would also recommend just looking through and seeing what are some of the resources that we have out there that can assist with out-of-pocket cost for hospital bills.
Thank you so much, Audrey, and thank you for the question. And now you're going to hear why I was so eager that I could barely let you finish, because I don't think anybody's really going to believe this. This is just serendipitous. Needy Meds has just partnered with a nonprofit organization called $4. And if you check out our upcoming calendar of events for webinars, you will see literally a webinar titled Charity Care 101, How to Get Your Hospital Bills Waived. And this is a webinar specifically about what Audrey was just talking about, explaining charity care programs at most hospitals. So check that out. If you are interested in learning more about how to crush those hospital bills. Thank you so much, Audrey, for that very thorough response. Again, not surprising. Another question that came in, Audrey, and I bet this is also a common one. And this is why I love when our audience participates and asks questions, because I say this all the time. If there is one person thinking of it, there's probably a bunch of other participants thinking of it as well. And it's a great opportunity to give our panelists a chance to drive home important points or share some more information. So this question came in, which is, do I have to ask my pharmacy to call HealthWell to apply for me?
That's also a great question. And actually, just going back to the last question that we talked about, that $4 is actually one of the programs that is also on our list of uninsured resources. So that's great that we both kind of thought of that. So for this particular question, though, patients can apply for assistance, or anyone who has the permission of the patient, such as a family member, friend, or advocate, they can apply for the patients. We don't restrict as far as who can apply. I mean, the provider can apply on behalf of the patient, the pharmacy, and then also the patient or their caregivers or whoever else that they need the assistance from, as long as they have the permission of the patient to apply. So we make sure that we are providing that opportunity. So there is a way to just be able to attest and say, I'm applying on behalf of the patient, and just attesting that the patient is aware of that. And then they can go ahead and apply for the assistance. I do want to say, though, that the majority of our applications that come in are from our providers and pharmacies, which we prefer that way, because they really are, when they apply for the patient, they're able to manage the grants, they're able to submit claims on behalf of the patient. So a lot of times the patients don't even have to see any out of pocket, because they're able to just submit the claims and we pay them directly. And so the patients are able to get the assistance, and they don't have to worry about trying to, gather the information to submit the claim themselves or paying out of pocket so that we can reimburse them.
That is such a great question and another thorough response. And I'm so glad it came up, because now as you explain it, Audrey, that makes sense. If you can have a pharmacist, a doctor, healthcare provider pay on your behalf, not only does it seem to streamline it, but as you said, it's not the extra burden of having to pay anything out of pocket and get reimbursed. So that's quite something. Here's another important question that came in, gives you the opportunity to clarify this. This participant asked, can I use the assistance HealthWell provides to pay for my health insurance premiums and copays? Great question, because we know those can be quite pricey.
Yes, and it is true that I think about 90% or so of our disease fund, you can use it for either premium assistance or copays. But there are certain funds that are only for copays. So for those, you won't be able to use it for a premium. But in addition to that, when you're applying for those funds that do have copay or premium assistance, you have to select one that you would like to apply to. So if you're interested in applying to the premium fund, you must select the premium. so that that assistance would be used specifically for premium assistance. At this point, they're not able to use both, to use it for both. So that you can't use it for premium and copay. You have to use it for one or the other. But we make it easy so that they can apply for this assistance.
That does make sense. And as all of our participants, I'm sure, can see now, not only is HealthWell a great resource because they do cover so much for people who are underinsured, and we certainly know that the population of people considered underinsured just seems to be growing. But as you can tell from Audrey, her presentation, her PowerPoint slide deck, and the website, HealthWell really goes above and beyond to make things very clear and as easy as possible. That's why I keep encouraging everybody to check out that website, because you will be pleasantly surprised at how straightforward and simple everything is. So let's get to another question, which is really important. This person shared that there's actually a fund that they wanted to apply for, but unfortunately it's closed. Do you have any idea how if you could share when it would be open, or if the person can anticipate when it will be open again? Can you chat a little bit about that, Audrey, please?
Yes, and thank you for that question, because we do get that question a lot from patients that are asking about funds that are closed. And the way that our funds work is that our funds open and close based on the patient volume and the available funding that we have available. So once it opens, if we have a large patient volume, then it maybe funding can go maybe a little bit more quickly than if we have not that much of a patient volume. But either way, there's no way for us to really predict when a fund will reopen or close, only because we rely solely on donations that we receive from the help of those that donate to us, and then we open the fund once we get funding. So everything on our website currently is real time. So what I would say with that is that I would encourage you to sign up for the real-time fund alerts to receive notification when the fund opens, so that you can apply quickly. Because as you know, some funds open and it goes very quickly. So having that tool, the real-time fund alert, it will alert you. It can call, text, email, voicemail, lots of different options, so that it can let you know when the fund open, and so that you can apply quickly and be able to get that assistance that you need.
Great question and great answer, of course. Thank you for explaining that. We have actually a couple of people, maybe 3 or 4 people, asking a similar question, which is the core of it really is this. Do people have to repay the assistance they receive from HealthWell?
Okay, that's also a good question. So our services are always free. You do not have to repay the financial assistance that you receive from HealthWell. That is very important for us to let people know, that we don't charge to be able to assist you to apply for assistance. And once we give you the grant, we don't ask you to repay it back. The grant is a financial grant simply for you to be able to use it to pay your out-of-pocket cost. That would be for your medication. In some instances, for instance, the cancer-related behavioral health, sometimes it's for the service. So it just depends. But for the most part, for all, I should actually say the most part, for all our funds and all our assistance program that we offer, it is always free of service. You don't have to pay it back. And if you're eligible, we provide that assistance so that you can use it to pay for your out-of-pocket cost, and it's charity to you, so you don't have to pay it back.
So important, and I'm so glad that question came in, because I know we get this sometimes at Meaty Meds, and I've actually heard feedback from some of our users that we refer to HealthWell, and it's that people will sort of, the sentiment is, this is too good to be true. Am I missing some sort of a fine print?
Exactly.
Exactly. So I'm sure Audrey, the team at HealthWell, has to figure out a bunch of different ways to assure people that, no, we really are helping you if you need it, and you don't have to pay it back. So I'm so glad somebody gave you the opportunity to drive home that point, because it's another important one. So
Definitely.
right. And again, I would think that that's a question you get quite a bit as well, Audrey.
Yes, we do. We do get that question quite a bit. And I think part of what is on that video The 2 minute, it's a very quick 2 minute video about charitable patient assistance program. It does cover that to let you know that it is not something that you have to pay back. It's a grant that is charity to you.
That's great. And as I said to everybody participating, you will receive a link to that video, which I'm really eager to share with you. So as I said, we do try and keep this question segment relatively brief. So I'm going to go ahead and wrap it up with one final question for Audrey. If it is your question, excuse me, if it is not your question and we don't get the chance to answer your question, we thank you so much for participating. And don't worry, we will get in touch with you as soon as we can. But as I said, reach out to the healthwellfoundation.org. Check it out. Maybe you'll find your answer on their site, or you can reach out to their toll-free helpline, which is 1-800-675-8416. Of course, if you have questions for Needy Meds, you can visit our website, needymeds.org, or call our toll-free helpline, which is 1-800-503-6897. Okay, so let's get to this last question, Audrey. And this is another good one. I think it applies to a ton of people that reach out to the HealthWell Foundation for assistance. And the question is, this individual shared that they actually don't file taxes because she's on Social Security. The question is, do I need to know my income before I apply to HealthWell?
Okay, that's a great question. And part of our application process is that we really try to make it very streamlined and simple so that you don't actually need to know your income. You don't have to know that information while you're applying. Because while you're applying for assistance, we verify through a third party to make sure that your income falls within our guidelines. And as you know, as I shared before, we have the guideline, which is up to 500% of the federal poverty level, depending on what disease fund that you are looking at. So for that, you don't have to provide anything upfront. You can just apply. And if now we're able to verify through a third party that you meet our eligibility guidelines, then we are able to offer that assistance. At times, though, we may have to come back if we're not able to verify that information and request for you to provide your income documentation. And so if that happens, you can go ahead and submit your income. And if it's Social Security, you can submit that too. And what you can do is that you can either fax it to us at 800-282-7692, or you can go ahead and upload it in our portal. So you can upload it to your account and then we'll be able to receive it and review it that way. You can also mail it if nothing else. If nothing else fills it. I believe our mailing address is HealthWell Foundation, P.O. Box 489, Buckystown, Maryland 21717. So yes, so that is, you can also mail it to there if that's the case that you need to submit documents for your income.
So important. Thank you for the question and for that answer, Audrey. And I'm going to ask you, for those just listening in, to please, if you wouldn't mind, go ahead and repeat the fax number as well as the mailing address of the HealthWell Foundation, just because I don't have that up on the screen. And I'm sure for those of you listening and joining us today, you can find that information on healthwellfoundation.org anyway, or you can reach out to their toll-free helpline, 1-800-675-8416. But since Audrey mentioned it and we've got her here, I figured giving her an opportunity to just repeat both the fax number and the mailing address for participants.
Sure. It's 800-282-7692 for the fax number. And if you wanted to mail them, then you mail it to HealthWell Foundation, P.O. Box 489, Buckystown, Maryland 21717.
Beautiful. Thank you so much for that. And, you know, as you have heard us both refer to partnering to $4, that nonprofit that helps people crush medical bills. And Audrey talked about how how patients can apply for grants and they can verify income through a third party. This is all my long-winded and roundabout way of saying both the HealthWell Foundation and Needy Meds
go out of our way, we would like to think, to make applying and being connected with healthcare savings resources simple. That being said, we also understand that we can't always be the solution for everybody, unfortunately. That's why we are proud to not only partner with each other, but also we all partner with other mission aligned nonprofits across the country to make sure if people reach out to us, that if we can't meet their need, that we work with a great partnering organization who can. And like I said, I think that was evidenced by the fact of us both partnering with that nonprofit $4. Just bear with me one moment, because as you can hear, there's a little interruption in the background. So I'm just going to take one moment to let that pass by, and hopefully it did. And the reason I mentioned stress Audrey's response to whether or not an individual has to know their income or share their income before they apply, and Audrey shared that they're able to verify that through a third party. Where I was going with that, at least where my mind went, was reach out to the HealthWell Foundation and apply. If you're not sure if you qualify, speak with somebody or apply anyway. We encourage you to do the same thing at Needy Meds, because if we can't be the solution, maybe we have another nonprofit that can. So with that, I'm going to wrap up today's presentation and offer a huge thank you to my friend and colleague, Audrey, for taking time out of her busy schedule to share her expertise about HealthWell with the Needy Meds population. And of course, a big thank you to our audience for taking time out of their day to learn a little bit more about Needy Meds and a lot more about the fantastic partner HealthWell Foundation. Please check out their website, follow them on social media. And as I said, you will get a couple of follow-up emails, one right after today's presentation. And moving forward, you'll get that follow-up from me, which will include a video of today's presentation, as well as that quick 2-minute video about HealthWell Foundation that Audrey referred to, some attachments we think you'll be interested in, and some other fun information that you will hopefully find useful and interesting enough to share with family, friends, loved ones, neighbors, patients, and clients. Thank you so much, everybody, for your time. Have a happy and healthy rest of the week, and we do hope to see your names pop up in future webinars. Thanks, everybody, and thanks, Audrey.
Thank you so much for having us, Carla. Thank you, everyone, and have a great rest of the day.